I was actually a reviewer on this article that took all the literatures by Miru and colleagues, and they took all the literature about pulley injuries, compiled it together, and then put a review of what they thought on it. And there is only one thing that they've been able to identify that classifies as potentially playing a role in preventing these injuries. And it's not taping, it's not a strength exercise, it's not mobility. It's actually just warming up effectively and slowly increasing the amount of load. They mentioned between 50, 60 moves per hand of increased load is when the bowstringing, which is the rope kind of pushing into the quick draws, and that's a normal physiological thing that occurs. It's just you don't want it to bowstring so much it pops out. But when that bowstringing reaches its maximum and you know that you're warm. And so I'd say the prevention, honestly, the best research we have right now is progressively loading to warm up your fingers is all we have. For rehab, no, we have a lot more. What?
Progressively loading up to max. So going from like very, very minimal all the way up to maybe move 50 or 60 is like close to your max effort.
It doesn't have to be a max effort. It just has to be each one. I almost tell climbers go to maybe to like 70. We're actually doing a study right now on max and peak performance. And so maybe in a couple of months, I'll have the results on that one. But yeah, no, it's not, you're not going to max. You're just slowly increasing. And that's really the smartest thing you can do. Cardiovascular warm up, increase some mobility, and then just slowly load your fingers, whether that is on a route or boulder problem or like a block that you brought to the crag. All is fair.
Yeah, and it could be isometric curls using a force board or, a force gauge type thing, or it could be just feet on the ground, no hangs, to progressively taking less and less weight off of your body with your feet to the point where now you're just like hanging body weight or something, essentially a variety of different ways, just to each one gets a little bit progressively harder to the point where it's 50 or 60 moves, and then we're good to go try hard.
Yeah, and the best warm-up program is the one that you do. So that's essentially, the one that you can consistently do that is giving progressive challenge. So okay, I don't think there needs to be anything fancy. Yeah.
We've done our warm up. We're great, but one day we go to the gym and we're just pressed for time, and our buddies are already crushing the moonboard, so we just hop right on and pop. Now what?
All right. So now you have to figure out what grade of injury it is. And that is the most important part of the process. I will give you an article that people can determine on their own. There's two ways to do it. One is you go see a medical provider that does diagnostic ultrasound. They'll put an ultrasound device on your finger, and they'll be able to measure how far that rope is pulling away from the rock wall and the quick draws. And they'll have that number. And based on that number, they said, this is your grade. So that is the gold standard. Who has access to that? Not that many people at this stage. So there's a clinical criteria that Carrie Cooper and colleagues developed where you just test yourself in this like spreadsheet. You like test this like crimp grip, you test like a sloper grip, you test your range of motion, you check these boxes, you add them up, and then it tells you, is it mild, moderate, or severe? And then based on that category, great. Now you have your timelines. The timelines are all identified. You just go to the spreadsheet, and now you know when you can climb, when you can load with no pain, when you can load with some pain, and you have your whole protocol laid out.
All right, y'all, just a quick minute here to shout out today's sponsor, which is Scarpa. Oh, I'm so psyched. My very first pair of climbing shoes and approach shoes were by Scarpa, and I have loved them ever since. I'm so grateful that they're supporting the show here. Y'all, whether you are smearing granite like Amity Warm, towing into steep pockets like Maddie Hong, bouncing from volume to volume like Nathaniel Coleman, or tossing crazy heel hooks like Alex Puccio, Scarpa has got you. They have been making the best footwear for peak performance as well as sustainability since 1938. They are here to take care of your adventures. You can shop the entire collection at scarpa.com. Scarpa, no place too far. Let's get back to the video.
So I think the most important thing is, I'll link the article in. It's like an awesome resource. I also did a video, like a YouTube video, because I'm just like, I'm seeing so many of these injuries that I don't have to see. Like, I can literally just record myself, with each patient, what I'm doing, and that'll be a little bit more effective. And so, so that is the process. And then, but that's the big take home. Figure out your grade of injury and then follow the timelines.
Okay, and so just to follow that path for a second, and then let's talk about splinting and anything else that we might want to do to address that very common injury. In terms of if it says, okay, maybe you could give an example of a mild or a medium, whatever kind of makes the most sense here. I'm assuming kind of severe is going to be the one that we'll talk about in a bit here with more extensive treatment that's recommended. But in terms of loading with some pain versus loading without some pain, and just understanding what this injury actually is, in terms of when is it good to allow some pain while doing some loading versus when should I just rest and not touch it. There just seems to be, and from my uneducated point of view, a couple of schools where it's like, you'll hear like, don't do anything, rest forever. And then you'll hear another school say like, no, complete rest is not the right thing. You need to send more blood and stimulus to this area. And so just understanding a little bit about what that looks like, if let's say it's a, mild to moderate, and we'll link to the paper in your video as well, but just talk me through what that looks like once that happens.
Yeah, so maybe I'll say moderate. And so a moderate would be classified as like a grade 2 if you were to utilize ultrasound. And so how I typically break it down is climbers will return to climbing, and let's just make it super simple: easy, moderate, hard climbing. There's way more levels to that, but let's just call like those 3 categories. And then fingerboarding, which all climbers want to get back to, most climbers, I guess, want to get back to. There's no pain and there's low pain. Is that fair to just say those are like the criteria that we're kind of juggling?
Yeah.
And so, they're fairly clear. Expert opinion, and by expert opinion, there's a few like Luder and colleagues and Schneeberger and colleagues in 2021 and 2016 had some papers that identified, their expert opinion, which is the same. I'm giving a quote unquote expert opinion. We don't have the research yet for this, but this is
right.
the pooled communal opinion based on clinical experience. No pain hang as early as 2 to 4 weeks is, after your injury of a grade 2, you can start hanging with no pain. So sometimes as early as 2 weeks after, I have climbers, on the fingerboard.
Wow.
For like low pain hang, that's typically about 6 to 9 weeks, when the tissues have remodeled and you're okay to generate some symptoms because the early stage of healing has occurred. And then easy climbing, I'll sometimes get them within a month. Grade 2 injury, within a month, get them back on the wall, easy climbing. And then hard climbing, kind of that late stage, 9 to 12 weeks is kind of the realm for that. And so those are the global kind of balloons, let's say, for a grade 2 injury.